Marcela Betancourt. I am the director of Latino Policy Institute, and thank you for joining us. So we'll have everyone else introduce themselves. We are here today hosted by the Economic Progress Institute and the Justice Center as well. We'll have the presenters kind of introduce themselves as well. I did want to let you all know that we are recording this webinar, and we are also sharing it on Facebook so that those of us who can't join us right now can view it later. So we'll start off. Today's presenters are Veronica from the Rhode Island Legal Services, Rachel Flum, who is the Executive Director of the Economic Progress Institute, and Jennifer Wood, who is the Executive Director of the Center for Justice. You'll see them in a little bit. And so today, who will we discuss? We'll talk about Rhode Island employees who may be worried about the new risks, not only health but safety-wise as they return to different jobs. We'll also focus mostly on low-income employees, and we'll also cover resources for undocumented individuals. Before I go to the next one, I also do want to say that we will have, if you have any questions during the presentation, we invite you to write them down in the chat. Every single question will be recorded, and we'll have some time at the end to answer some of your questions. And so what's the focus of today? So what are some of the requirements for a safe workplace, and what happens if the place of employment is not following those? Also, if the place where you work isn't safe, it's safe, but you can't go back for several reasons that may or may not be related to COVID-19. What are some of the things that you can do, either applying for benefits or so? So if you're working but need to take time off, what are some of the options in the next few months? And where can you understand more of your rights, and as well as what services are available for individuals who may be undocumented? So with that, we will kick it off to our next presenter.
Hi, this is Veronica Cott. I'm an attorney with Rhode Island Legal Services, and I deal with employment issues, unemployment issues there right now. So as you can imagine, I'm pretty busy. And I wanted to talk very briefly today about what are the requirements in the law right now for a safe workplace, given that we're in the middle of a pandemic. And what can you do if you're concerned that those are not being implemented? And also I wanted to talk about what you can ask in addition to the usual safety regulations if you have a particular condition that requires more accommodations. I'm also going to touch on the streams of income that might be available if, despite all these safety regulations and provisions, it's still not safe or allowable for other reasons for you to come back to work and you're being called back to work. So the first thing that's outlined on this slide is that there are emergency health regulations on the Department of Health website. And some of the provisions that apply to all workplaces that are open during this pandemic include things like free masks for employees provided by employers, screening for illness. You may already have been screened in many places when you come in for temperature, questions asked about your recent travel or association with other people. So those are some of the screenings that will be and should be occurring at all workplaces. There should be posters readily visible about basic distancing, social distancing, and other safety measures and rules applicable to that workplace. Additional room for social distancing whenever possible is a very important one. And the obvious: water, soap, sanitizer, cleaning procedures consistent with CDC guidelines. Those are all some of the requirements. In addition, every workplace is required to have a plan for safety. It doesn't have to be publicly available or handed in to anyone unless and until the Department of Health requests a copy, but it has to exist, and it's there so that employers can actually prepare for and think about these measures and how they're implementing them in their particular environment. In addition, employers are required to cooperate with the Department of Health whenever there's an investigation due to a flare-up. They have to have a designated individual who is in charge of implementing these conditions. And they have to provide employee training at a minimum so employees are aware of their responsibilities and their rights about health and safety in pandemic times. In addition, there are specific regulations on that same website that govern particular types of workplaces. And they're too detailed and specific to go into here, but feel free to look on either the Department of Health or the Reopening Rhode Island website for work sectors such as childcare centers and offices and others. What to do if you look around you and you don't feel safe because you don't feel that these are actually in place. There are several things you can do. Obviously, the first line of resistance is if you have that kind of work setting to try to work it out with your employer or your union. But if that's not working, you do have the right to call the Department of Business Administration website, the Department of Business Administration hotline number, which is listed right here. It's 889-5550. We have been assured that it is a confidential line. You can leave your name, your phone number. You should be called back. There should be some investigation of what you say. And I do know that there have been enforcement measures taken in Rhode Island as a result of these kinds of phone calls. At Legal Services, we are taking calls from people who have these kinds of concerns, and we are very happy and open to hearing what your experience has been with this line if you have a problem. The Center for Justice has also made itself available, so our phone numbers are on this slide. And you can also call the Rhode Island Department of Health at their COVID-19 info line in order to learn more information and to report any concerns. I did want to take just a second to talk about reasonable accommodations in the workplace. In addition to the health and safety precautions and rules and regulations that apply to all workers, if you have a health condition that under pandemic circumstances creates an additional risk of going back to work, you do have the right to talk to your employer about reasonable accommodations. Health conditions that might not have amounted to a real disability prior to the pandemic could amount to such a disability now if they put you at additional risk. What are some of the reasonable accommodations that you could ask for? Well, if it's possible to work remotely in your workplace, that might be one. You might ask, if that's not, you might ask to be transferred to a work site or a location within your workplace where you have less exposure, for instance, to the public. These are some of the things that you might want to brainstorm with your doctor. Under what circumstances is it safe for me if I'm immunocompromised or have undergone chemotherapy recently? Something that might not have prevented me from working before, but now might offer additional risk and exposure. What would be sufficient for me in the workplace to make those general health and regulations also apply to me and to expand their span to accommodate my particular health circumstances? Now, if your workplace is as safe as it can be under the conditions, but you still cannot go back even with reasonable accommodations, there are several funding streams and income streams that could apply to you and that could continue to provide you with the support you need not to go back to work. Under some circumstances, unemployment insurance is available, and there are now two types of unemployment insurance. There's the kind that always existed when you're out of work due to layoff or a no-fault termination. And then there's the pandemic unemployment assistance, which is federally funded. It's the assistance you've probably heard of that Congress passed some months ago for individuals, which expanded unemployment insurance, regular unemployment insurance, but which also created a fund that can be used for people who are not usually eligible for regular unemployment insurance. These include people who are, for instance, independent contractors, self-employed, gig workers such as Uber drivers, or people who don't qualify for regular unemployment insurance for one reason or another, including not having had enough recent work history or earnings to qualify. But the basics of pandemic unemployment assistance is that you do not qualify for the regular unemployment assistance. And in addition, there are other funding streams such as paid leave, whether state or federal, and paid sick leave, state and federal. And other speakers will discuss those additional paid leaves and paid sick leaves in a few minutes. But I wanted to move on to the next slide and talk a little bit more in detail about unemployment benefits. So for instance, if you can't work due to COVID-19 because you yourself are sick or quarantined, or you have a health condition your doctor tells puts you at risk, even with workplace accommodations, or you're taking care of a sick person, or you're taking care of a child who is learning from home, whose childcare is closed, or that includes an adult who needs daycare, like an individual with advanced Alzheimer's who usually goes to daycare and that daycare is closed. You may still be eligible to continue to collect unemployment, and you would be excused from returning to work or accepting an offer of work under a good cause exception from returning to work. What's important to remember in practice here is that document, document, document. If one of these conditions or situations applies to you, try to obtain the appropriate documentation from a doctor, a doctor's note, from a daycare center, evidence that the daycare center is closed. Share that information, especially with your employer, if your employer is calling you back to work. You want to prevent a situation where unemployment decides that you quit without good cause because they received a notification from your employer. You want to prevent discontinuance. You want to prevent a denial of unemployment benefits if you can. If you can't, there are still ways of appealing decisions that deny you benefits, but those take time, and you might find yourself without income for the duration of trying to figure that out. If in doubt, or if you need assistance talking through how to document or whether you have sufficient good cause not to return to work, at Legal Services, we are available to talk to you about these situations and talk you through the individual circumstances that would document good cause or that would qualify for good cause. So if you're applying for unemployment insurance, it's important to know that right on the DLT website, which is listed right here, there are two types of applications. There's the regular unemployment benefit that we discussed before, and then there's the pandemic unemployment assistance. They have different baselines. The unemployment benefit is based on your history of earnings, and the minimum is $53 a week. The pandemic unemployment is based on earnings, but there's a minimum benefit equal to half the state's average weekly unemployment insurance benefit. One of the things to remember in trying to decide which one to apply for, and it's sometimes hard to know, the pandemic unemployment assistance is there if you don't qualify for unemployment insurance benefits. We did receive assurances from the Department of Labor and Training that if you apply for the wrong kind of benefit and then are required to reapply for the correct one, they will backdate your unemployment benefits to the first application. In practice, I have seen and heard from many clients that that hasn't happened, certainly not automatically, and it requires some level of advocacy. So if in doubt, again, which one to apply for, at Legal Services, we are available to try to help you walk through which one is the best one to apply for. It has been very difficult to reach the Department of Labor and Training to get that advice. And it's best to apply for the right one to avoid further delays in getting it. I did want to talk about the good news first, which is that the length of potential receipt of unemployment benefits was extended by federal law. So you could receive up to 39 weeks total of unemployment insurance now due to Pandemic Emergency Unemployment Compensation Act. The bad news is that the initial $600 of additional weekly payments that were available for recipients of unemployment insurance have now expired. They expired at the end of July. Congress did not reach a compromise in order to renew and extend them. We don't know if they still will or won't. You may have heard about an executive order from the president that purported to extend these benefits at least to $400 a week. However, in practice, that isn't happening in most places because it looks like it requires state buy-in, and most states have not been able to dedicate the funds necessary to do so. So currently in Rhode Island, there is no additional weekly payment on top of whatever your base payment is. Hopefully that will change, but for now, if you go on the DLT website, it will tell you that there are no additional benefits being issued. And with that, I would like to hand it over to Rachel, who will talk about paid leave and paid sick leave available in Rhode Island.
Yes, thank you, Veronica. And as people have questions that come up, please put them in the chat and we will get to them at the end of the presentations. So I am going to talk about paid leave and sick leave. We are fortunate to live in a state that has both of those programs in addition to what the federal government has offered and extended during this pandemic. But we know that they are confusing. So Veronica went through unemployment insurance, and generally people should be applying for unemployment insurance if they are unable to work for the reasons that she laid out. We know, however, that people have other reasons why they may not be able to go to work. If they have hurt themselves or they are sick, either with COVID or some other sickness, they should, and it's extended illness, they should apply for paid leave, which is this under the state program is called a temporary disability insurance. If you need to take time to care for yourself, you can get up to 30 weeks of partial pay. It's about 60% of your salary while you're out on leave. If you need to take care of another family member, so either a seriously ill family member or a new child in the family, either a baby or a child, an older child that you adopted, you can take up to 4 weeks of leave under the Temporary Caregiver Insurance Program, or TCI. And that can be, you can get 4 weeks of leave during any year period. So if you took it last year, you could apply for another 4 weeks if you met the qualifications of needing to care for someone. For both of these programs, you apply through the Department of Labor and Training. There was some flexibility at the beginning of the pandemic before the federal unemployment kicked in and they were funneling people through TDI in order to get them some income support if they were out of work because of COVID. Now people should apply for unemployment insurance if they're out of work due to COVID, but we just want to make sure that people know that they still have these programs available as for other issues that may come up for them. In addition, the federal emergency leave is a new program that is COVID related. You can take up to 12 weeks of leave. The first 10 days may be unpaid, and after that, their employer needs to pay you up to 2/3 of your wages. This is only if you are out of work because you have to care for a child who is out of school or doesn't have childcare because of COVID. So it's a very narrow program. It's childcare specific, but it does provide up to 2 weeks of leave. This is not a program that is through the state or through the federal government. You apply through your employer. So you would tell your employer that you need to take time off. They can apply for a tax credit to reimburse them for the time that you are out. And the size of the employer, they could ask for an exemption if they are smaller than 50 workers. But this is available, and we want to make sure that employees know it's available and that they ask for it. For both this and the sick leave, the federal sick leave, the person to contact if you're having any trouble with that is actually the U.S. Department of Labor Wage and Hour Division. And I did not write this on the slide, but there is a local office, and the phone number for that is 401-528-4431. Again, 401-528-4431. And so that is the office to call if you're finding that your employer is not providing the federal leave. So sick leave is meant to be for short-term illnesses or emergency illnesses. So if I feel like I have COVID symptoms, or I'm worried that I have the flu or whatever it is, it's not an illness that I plan ahead for or an emergency that I planned ahead for. It's something I need to take today. Rhode Island has a state law, which is fairly new, so we know that a lot of people don't know about it, that requires that employers allow employees to take up to 40 hours of sick leave a year. So that's 5 days, which they can take off in hourly increments. It can be used to take your child to the doctor. It can be used to pick your child up from school. You can care for yourself or a loved one. And the definition of who you need to care for is who you're a caregiver for. So you do not have to prove that they're related to you. You just have to say that you are taking care of someone for whom you have caregiving responsibilities. This is accessed through the employer. If you're in an employer who has 18 or more employees, they have to pay you for this time off. If you are a smaller employer, 18 or fewer, they may not pay you, but they cannot fire you for taking the leave. So it is job protected 40 hours during a year of sick leave. Again, if you're finding that this is a violation, if your employer is not providing you this time, the Rhode Island Department of Labor and Training is the office to complain to. At the same time, we have a federal emergency sick leave program in place, which provides up to 80 hours, which is 2 weeks, of sick leave, again, for COVID related specifically. So if you are sick, if you have to quarantine, if you're caring for a child because your school is closed, you could access full pay if you have COVID, or 2/3 pay if you're caring for a child. Again, I think it's supposed to say employers with 50 or more workers are exempt, not 500. But again, for this leave, you need to ask your employer for it. It is in addition to the state sick leave, so you should be able to get both. But if you have any troubles or problem with your employer around that, you need to call the U.S. Department of Labor Wage and Hour Division, which is the phone number I gave on the previous slide. And I think that is all I'm going to cover. So I'm going to turn it back over to Jen Wood from the Center for Justice.
Hi, everyone. My name is Jennifer Wood. I am the director at the Center for Justice, and we are able to provide legal advice and representation and assistance to undocumented individuals concerning workplace issues. Basically, we work in partnership with Fuerza Laboral, and I know Raul Figueroa is on our call today, so we're very grateful for that partnership. And oftentimes, individuals who are undocumented and may have questions about their workplace rights, we really encourage you to be in communication with Fuerza, and then they can assist in helping you to speak with one of the lawyers here at the Center for Justice. But basically, what we try to assist people with is that most of the state and federal laws that you've already heard about, paid sick leave, caregiver coverage, etc., most of these laws apply to anyone who is an employee in Rhode Island, regardless of their immigration status. So there are complications that come along with that, and a lot of employers may try to intimidate workers, feeling that they may feel insecure because of their immigration status, but the laws still apply and can still be enforced. Many of the issues that we talked about so far today, unsafe conditions in the workplace, being required to work hours that are not appropriate, being denied paid sick leave, these issues are also issues where a complaint can be made to one of the government agencies that enforce these rules, and the complainant does not usually need to be identified. So if a worker is undocumented and believes that there are unsafe or unhealthy conditions in the workplace, those complaints can be made and investigated without the employer being aware of who has made the complaint. So there are a lot of ways in which undocumented workers can advocate for themselves with assistance, and we really encourage people not to feel defeated or intimidated, but to speak with Fuerza, contact us, and we can assist you in knowing how you may be able to at least improve your situation. One of the things, and in that vein, one of the things I wanted to go back to quickly was Veronica's comment about when there's an unemployment insurance claim and it is because the worker cannot return to work or is unable to work and needs to demonstrate that there's good cause. In other words, the conditions otherwise might be interpreted as that they quit their job. The importance of documentation is so key there, because if the worker is just feeling defeated and doesn't call the employer, document that, send the employer an email or a note, or somehow write down what those communications have been, it will be very hard to prove good cause. Even if the employer seems to be completely unsympathetic to the situation, and even if it feels like it's a waste of time because the employer has already said, no, I'm not open to this, it's important to still make the phone call or send the note, because even though it seems like as a practical matter that's silly because the employer already said no, it's important to have that information later when the Department of Labor and Training looks at whether or not there was good cause for not being at work. So when Veronica was explaining that, I realized, oh, a lot of people might just not bother to do that because it would feel silly since you've already been told by the employer, no, you're not eligible, go away. But it is important to document that a doctor's note was provided, that there really was good cause for not returning to work or for not being able to work given the conditions in the workplace. So I just wanted to loop back to that for a minute. Now, I think if we could go on to the next slide, we're going to offer some examples. And as we were preparing for today's panel, we all recognize that it's confusing. There's a lot of information here. There's a lot of information about new benefits that even those of us who work in this area are scrambling to understand because of federal actions that have been taken. And also there's a huge rumor mill around what is happening federally and locally. So we do understand that caregiver leave, sick leave, family medical leave, and the pre-existing and new unemployment programs can feel pretty confusing, both to workers and to those of you who work at community action programs or other supportive environments. So we wanted to give a few practical examples of things that stories you might actually encounter, whether for yourself and family or in trying to help others. So I'm just going to talk these through, and you'll see that we have 3 examples, and then you can pose questions in the chat, and we'll be addressing questions at the end after we go through the examples and some other information. So our first example is someone named Rhoda who worked at Ocean State Seafood Restaurant and was laid off when the restaurant closed due to the pandemic. The restaurant has now reopened and is following all Department of Health guidelines. Her boss has contacted Rhoda about coming back to work. However, Rhoda has cancer and is being treated with chemotherapy. She was able to work while she was undergoing treatment prior to the pandemic, but her doctor has now told her that contracting COVID would be extremely dangerous for her in her current health situation and has told her not to return to her job, and in fact, not to work outside her home at all. This is one of the cases we were just discussing, where with documentation from the doctor, Rhoda would establish that she has good cause for not returning to her job, and she could continue to receive unemployment insurance rather than be treated as having quit her job. So next example. Juan works at the Ocean State job lot and has been working during the pandemic. His partner recently tested positive for the virus, and now he needs to take care of her. He would be eligible for at least 40 hours or 1 week, 5 days of paid sick time from his employer, because his employer has more than 18 employees, and that's the minimum that they would have to provide. Some employers may provide more than 5 days or 40 hours of paid sick leave, but that is the minimum under state law. He would receive his full pay for the days that he needed to take to care for his partner who has become ill. If his partner is out for several weeks, he may become eligible for temporary caregiver insurance, which will provide him coverage to care for a sick family member. He could receive up to 4 weeks of partial pay under that program, and that would be in addition to and after he uses his paid sick leave. And our final example, Frank worked for Easton Manufacturing Company, which has remained open and operating in accordance with social distancing guidelines during the pandemic. He lives at home with his mother, who has early onset Alzheimer's, but receives care during the day at a local senior center. Now, however, the center is closed. Frank tried to find other options for care for his mother, but was turned down. So now he has to remain at home with his mother, at least until the senior center reopens. He's been receiving unemployment benefits, and he would be eligible to continue to receive those benefits under the good cause exception. Even after whatever happens with the federal changes, under the state program, he would have good cause to remain out of the workplace and receiving unemployment. So those are our 3 case studies. And now I'm handing it off to our next speaker.
So Veronica, do you want to jump in on this one on who to go for help? I think you said this earlier, but we just wanted to reiterate.
Sure. You're all probably sitting there thinking that now that you know more, you know less, and we all feel that way. Each person's circumstances are unique. Sometimes you qualify for more than one benefit, and there are choices you can make. I've talked to clients recently who were told that they should get off unemployment and get TDI because they just had a baby. At the same time, that person was taking care of an elderly relative with Alzheimer's. So they would qualify for unemployment benefits, they would qualify for TDI. There's overlapping benefits and different choices that you can sometimes make. And in addition, you might be able to apply for more than one benefit, but there are strategic choices to make because right now it's taking a really long time to get through the application process. And some benefits are more time limited than others. So you may want to make decisions about which one is likely to last longer or which one offers a more livable amount under the circumstances. That's why Legal Services is available to answer those questions, to try to help you make the right choices that are for you, to understand which benefits or benefit you qualify for and which one is the best strategically and practically. So feel free to call us. We also provide assistance with other benefits that you may need to supplement income, such as SNAP, previously known as food stamps, health insurance coverage, and importantly, qualifying for stimulus payments. Stimulus payments really carried a lot of people over the beginning of the pandemic, helped them pay rent and basic necessities. Now that they're running out, a lot of people are hurting. Some people still haven't received them. And we do have a special unit for taxpayer issues within Legal Services that can help you navigate that system. Whether you received only part of your stimulus payments or didn't receive any, we can also assist you with those. So feel free to call us and you will be screened and directed to the right person to assist you if you're having difficulties with some of these issues.
Great. And I was just going to give a couple notes on health insurance and then the stimulus also. We know that we hope that a lot of employers have kept folks on their employer-sponsored health insurance, but we know that that may not continue going forward, and that there may be some anxiety around what happens if you lose your health insurance. So if you do lose your employer-sponsored health insurance, there are some options. Medicaid is one of them, which is no-cost insurance to the worker or resident. Your income varies depending on, the income limit depends on your family size, whether there are children in the family. An example would be if you are a parent that has a family of 3 with income about $35,000. The kids would be eligible for Right Care, which is the Medicaid program, but the parents would be above the income limit for Medicaid. And so they would be able to buy a plan through the Health Source RI with tax credits. So I probably should have given that example at the end. But so there's Medicaid. The eligibility is listed here, 19 and older. There are options available for some kinds of immigrants. Children under 19, again, would be eligible as they're part of their family unit. Pregnant women are eligible regardless of their status. And then again, if you are in a family or a parent who is above the income threshold, you can buy through Health Source RI. If your income is not over 400% of the federal poverty level, you may be able to get tax credits, or you should be able to get tax credits for that, to help you pay for that coverage. The good news is you can apply for Medicaid at any time. So if you lose your health insurance, you should go right on and apply. For the Health Source RI, for the qualified health plan, you can, when you lose your job, you have 60 days to enroll at any time. They do have certain timeframes where it's called open enrollment, where people can change their plan or enroll. But if you lose your job or have another life change, like you have a baby or you get married or you get divorced, you can also enroll within 60 days of that life event. The way to apply is either online at healthsourceri.com or by phone, and they should be able to walk you through your individual circumstances as well. And then Veronica mentioned the stimulus payment. We just wanted to make sure that people are aware, if they did not receive their stimulus payment already, that people should still file for that if they hadn't gotten it. If your income is less than $75,000 or $150,000, if you're a married couple filing jointly, you can receive $1,200 for an adult and $500 for a child under 17. For higher incomes, they received a reduced payment. So most people are getting some kind of stimulus payment. So if you or your clients that you're working with has not, you should look into that. If they have Social Security numbers, you have to have Social Security numbers in order to get the payment. It is not too late to file your taxes and get that payment. Anyone who has filed their taxes in 2018 or 2019 got the payment. There has been an extension, so if you failed to file your taxes during those years, you can go back and file them through September 30th. So we encourage people to do that. Again, you do that through the irs.gov portal, but someone at Legal Services can help you if you're having trouble walking through what that looks like. And just to highlight, hopefully you have seen the fact sheets that those of us on the panel have put together around this. There is a one-pager and then a longer two-pager. These are the links to them, both in English and in Spanish, and we hope that they are useful to people going forward. This is the links on where they are. And now I think I'll turn it back over to Marcella to ask questions.
Yes, thank you, Rachel. And so for those of you who still have some questions in your mind, feel free to add them in the chat. But we do have a few actually. So the first one is sort of general regarding paid sick leave. So does the paid leave need to be taken as all or nothing? For example, can you take it as part-time? So if you're working 20 hours out of 40 hours a week. I think that's for Rachel or anybody else who can answer.
Yes. So for the TDI program, for the TCI program, you cannot take it part-time. You can take it a week at a time. So if you need a week to take care of your mother who's broken her hip, you could take off for a week and then use the other 3 weeks later. But you cannot use it as a part-time supplement to your job. To your part-time job. For temporary disability insurance, you couldn't do it for COVID, we don't think, because you just would be out. But according to the DLT website, if you had a condition, so say you broke your back and your doctor said you could work part-time, but you couldn't go back full-time, then you might be able to get TDI for part of your week, but it would be dependent on sort of what the doctor had described as your availability to work. Okay, are there more questions for me on that? I think
there's actually quite a few about paid sick leave, so I'll go. The next one is probably shorter. You mentioned that the paid sick leave in our state is fairly new. So what is a minimum amount of time that an employee has to work in an organization before they can apply for sick leave?
Yes, so the way the sick leave in Rhode Island works is that you earn time. Your employer can give it to you up front, so can say you have a week of leave this year, but they may say that you have to earn it. So for part-time workers, you can earn time. You earn 1 hour of sick leave for every 35 hours worked, up to those 40 hours a year. The employee the employer can make you wait 30 days to take it. So if you're a new employer, you may need to wait 3 months in order to start to take those hours of paid sick leave. But you should check with your employer's policy around that to see how they've written it.
Thank you. And the next one, I think, also has to do a little bit with paid sick leave, but some of the examples that Jen gave is, so if an employer asks an employee to self-quarantine because of potential COVID symptoms, does the employee use their sick time or the federal sick time?
So I think the employer may ask that they use the state sick time first, but the employee should be able to get both of them. So it shouldn't matter which they use. But I don't know, Veronica, if you've had examples of this, but I think there are cases where the employer has asked that you use up your own sick leave first, which goes to the second question of, does it come out of your own bank of benefits? And yes, that 40 hours does. Veronica, can you speak to that anymore?
No, I think you covered that.
Okay.
Great. And so we have one question about the stimulus check. So what if a person has yet to receive their their stimulus and their 2019 return? What should they be doing?
Okay, so I think that I got this wrong. So I'm wondering if my colleague Linda Katz wants to jump on and explain this better than I can. Linda, can you be unmuted?
Yeah, can you hear me?
Yes.
Yeah, so just for clarification, and it does get confusing for folks. There are people who receive their, going too far, receive their stimulus payment automatically. So if you filed your taxes for 2018 or 2019, you automatically should have received your stimulus payment. If you received SSI benefits, Social Security Disability, Veterans benefits, railroad retirement benefits, those folks also should have received their benefits automatically. One caveat for people who filed, who receive federal benefits and should have received the payment for themselves automatically, is that they had to file through the non-filer portal to get the benefits for any dependents. And the federal government has just extended the time, you see where the 2 stars are, to file benefits for dependents. You can file through September 30th. So I get SSI benefits. I didn't, and I have kids. I didn't file. I got my benefit, my $1,200 automatically, but I didn't get the $500 for my kids because I have to file through the non-filer portal, and I can do that now through the end of September. So that's one situation. The second is anybody who didn't automatically get the benefits, right? Who didn't file their taxes or wasn't part of the group of people who get federal benefits and were sent the check automatically. There are about 30,000 people in Rhode Island in that circumstance, and they need to file through the non-filer portal. So those would be for people who, for example, had very low income, maybe worked part-time, and they didn't file a tax return. So anybody who didn't file a tax return for 2019 and or didn't get the payment automatically because they get a federal benefit should be filing through the non-filer portal to get the $1,200 for themselves and for their kids. And then just to go back, people who automatically got the benefit because they get federal SSI or SSDI, but didn't get the benefit for their kids, should file to get the $500 for their children. The time for filing your regular tax return for 2019 has expired, but the time to file through the non-filer portal has not. And as Veronica mentioned, staff at Legal Services can help people who have questions or maybe who should have received the benefit automatically but didn't. So I would say as a follow-up, if you're working with clients who have questions about their getting the stimulus payment, would be to contact Legal Services. And we also have a number of fact sheets on our website explaining getting benefits through the non-filer portal. I hope that's helpful.
Great, thank you. And I think the last question, Rachel, will we be sharing this presentation today with people?
Yes, we can email it back out to everybody who registered. And if you want the PowerPoint slides, and then the recording will be on Facebook, and we can also share that out if people want it.
Yes. And so are there any last minute questions? If you have some, please feel free to add them in the chat.
And Marcella, I wanted to just provide some information. Raul had mentioned that the best contact number during this period for him at Fuerza Laboral is 617-984-9643. I'll repeat that. And it's also in the chat, 617-984-9643. So thanks for updating that, Raul.
Thank you. All right. So if we don't have any more questions, does Veronica or Rachel, do you have anything else you'd like to add?
No, I would just point out that all of the organizations on this call, and including the Immigrant Coalition, have a lot of resources on their website. So just point folks to those, and please feel free to reach out to any of us with further follow-up questions. We know it's confusing. So thank you all for your interest and for joining us.
Thank you, everyone. Have a good rest of your day.